Frequent urination is often brushed off as a harmless inconvenience, something caused by drinking too much water, getting older, or having a small bladder. But this assumption is one of the most common and dangerous misunderstandings in urology. If you are urinating more often than you used to, especially if it is disrupting your sleep, work, or daily routine, your body may be signaling an underlying problem that deserves attention. The truth is that frequent urination is not normal when it is persistent, progressive, or unexplained, and ignoring it can allow silent conditions to worsen long before pain or serious damage appears. I am Dr. Emily Carter, a urologist, and today I want to explain clearly and calmly why frequent urination happens, what it means inside the body, and why it should never be dismissed as just a minor annoyance. My goal is to help you understand the physiology behind this symptom, recognize when it becomes a warning sign, and feel empowered to seek proper evaluation before complications develop. To understand frequent urination, we first need to understand how the bladder is designed to function. The bladder is a muscular storage organ that gradually fills with urine produced by the kidneys. As it fills, stretch receptors in the bladder wall send signals to the brain, increasing the sensation of fullness. A healthy bladder can comfortably store urine for several hours. When it is time to urinate, the brain coordinates a precise process in which the bladder muscle contracts and the outlet muscles relax, allowing urine to flow freely. When this system is working properly, urination is predictable, efficient, and does not dominate daily life. Frequent urination occurs when this system is disrupted. It does not always mean that the kidneys are producing too much urine. In many cases, it means the bladder is unable to store urine normally, empties incompletely, or has become overly sensitive. This distinction is critical because treating the wrong cause can delay real solutions. Many people focus on how often they urinate, but the more important question is why the bladder is signaling the need to empty so frequently. One of the most common reasons for frequent urination, especially in men over 40 and women after midlife, is incomplete bladder emptying. When urine remains in the bladder after urination, the bladder fills again quickly, triggering repeated urges to go. This often happens due to bladder outlet obstruction, such as prostate enlargement in men or urethral narrowing and pelvic organ prolapse in women. The bladder works harder to overcome resistance, becomes irritated, and loses its ability to store urine efficiently. Over time, what starts as mild frequency becomes a constant disruption. In men, an enlarged prostate is a leading cause of frequent urination that is often overlooked. As the prostate grows, it compresses the urethra, restricting urine flow. The bladder compensates by contracting more forcefully and more often. This leads to urgency, weak stream, nighttime urination, and the sensation of never being fully empty. Many men believe these changes are normal aging, but clinical studies published in urology journals consistently show that untreated prostate obstruction is a major driver of chronic urinary symptoms and bladder dysfunction. Nighttime urination, in particular, is a powerful clue. Waking once occasionally may be influenced by fluid intake, but waking repeatedly to urinate is not normal. It often reflects a bladder that cannot store urine properly or one that never empties fully. Research shows that nocturia is one of the earliest and most disruptive symptoms of bladder outlet obstruction and bladder dysfunction, yet it is one of the least likely symptoms to prompt medical evaluation. Another major cause of frequent urination is bladder overactivity. In this condition, the bladder muscle contracts too often or too easily, even when the bladder is not full. This creates sudden urges that are difficult to delay. Overactive bladder can develop as a result of aging, chronic obstruction, nerve dysfunction, or repeated bladder irritation. The bladder essentially becomes hypersensitive, sending urgent signals prematurely. This condition affects both men and women and can significantly reduce quality of life if left unaddressed. Nerve health plays a crucial role in bladder control. Conditions such as diabetes can damage the nerves that regulate bladder sensation and contraction. This damage may cause the bladder to misinterpret fullness signals, leading to frequent urges to urinate even when urine volume is low. Neurological conditions such as spinal stenosis, multiple sclerosis, Parkinson's disease, or prior strokes can also interfere with bladder signaling. In these cases, frequent urination is not a bladder problem alone, but a symptom of disrupted communication between the brain and urinary system. Urinary tract infections are another well-known cause of frequent urination, but what many people do not realize is that recurrent infections are often a consequence, not the root cause. Incomplete bladder emptying creates stagnant urine, which allows bacteria to grow. Treating infections repeatedly without addressing the underlying retention leads to a cycle that continues indefinitely. In clinical practice, we frequently see patients whose frequent urination improves only after the bladder emptying problem is corrected. Hormonal changes can also influence bladder behavior. In women, declining estrogen levels after menopause can thin the lining of the urinary tract, making the bladder more sensitive and prone to urgency and frequency. This does not mean frequent urination should be ignored, but rather that it should be evaluated within the broader context of urinary health. Proper diagnosis allows targeted treatment rather than assumption. Medications are another silent contributor. Diuretics, caffeine-containing supplements, certain antidepressants, and medications affecting the nervous system can increase urinary frequency or reduce bladder storage capacity. Large population studies show that older adults taking multiple medications are significantly more likely to experience bothersome urinary symptoms, often without realizing the connection. What makes frequent urination particularly concerning is its long-term impact when ignored. A bladder that is forced to empty too often loses its ability to stretch and store urine. Over time, bladder capacity decreases, urgency worsens, and sleep disruption becomes chronic. Persistent sleep interruption has been linked to fatigue, cardiovascular strain, metabolic dysfunction, and reduced cognitive performance. In severe cases, chronic bladder dysfunction can contribute to urinary retention and kidney stress. I once treated a patient who believed her frequent urination was simply anxiety-related. She had adjusted her life around bathroom access for years. When evaluated, we found significant residual urine in her bladder and early kidney changes due to chronic obstruction. With proper treatment, her symptoms improved dramatically and further damage was prevented. This pattern is far more common than most people realize. Diagnosis of frequent urination is not guesswork. Simple, non-invasive tests can determine whether the bladder is emptying properly, how it stores urine, and whether obstruction or nerve dysfunction is present. These evaluations are designed to protect long-term health, not to rush anyone into treatment. Early assessment allows simple interventions before complications develop. Treatment depends entirely on the underlying cause. Addressing obstruction, improving bladder emptying, calming bladder overactivity, adjusting medications, and supporting nerve health can all significantly reduce frequent urination when applied correctly. The key is identifying why the symptom exists rather than masking it. The most important message I want you to remember is this: frequent urination is not normal when it is persistent, progressive, or disruptive. It is not something you should simply accept or adapt to. It is a signal, and signals exist to be understood, not ignored. Your urinary system is closely connected to your kidneys, sleep, energy, and overall health. If you notice that you are urinating more often than you used to, especially at night, or if urgency is controlling your day, listen to your body. Early evaluation protects bladder function, preserves kidney health, and restores quality of life. If you found this explanation helpful and want more calm, medically grounded education on bladder health, prostate issues, kidney function, and urinary symptoms, subscribe to this channel. Staying informed helps you recognize warning signs early and take control of your long-term health.